I am so happy to be sharing my personal experience with going through um, the procedure that I've gone through because I'm very holistic and I don't want to be one of those who have to be on antidepressants for the rest of my life. So when this was offered to me or suggested to me by my therapist, psychologist, I'm like, sign me up, I'm in. And then I was excited, I said, so it's going to remove the fog? Can it increase my thinking and get me back to where I was, where I'm boom, boom, boom on task? And it's doing exactly that. But here's my doctor, and I've gotten some challenge questions for her, for other people that have said, well, do you really think it's working, or how long does the effects last? Is it temporary? How can you prove that it's actually working for you, and things like that? So, Dr. Ali, can you please kind of explain that to the audience?
Absolutely. First of all, I want to give a disclaimer here that I didn't know about the questions. So whenever she's asking me, it's all a surprise, but I love doing TMS treatments for my patients, so I'll be happy to answer all these questions. FDA approved TMS in 2008, so it's not a new treatment. There was a lot of research going on this treatment for a while, and you know that FDA is not going to approve a treatment unless we have enough evidence for that. But recently it is becoming more common because in the past people were reluctant to try something, to come to the office every day because you have to come to the office for this treatment, can't be done remotely. But as we have seen more and more resistance to antidepressants and the side effects of like weight gain and sexual side effects, there are a lot of patients who are turning towards the non-pharmacological treatment options, and TMS is one of the most effective treatments known to the world of psychiatry. So I started doing this in 2019, and at first we had just one chair, and now we have three chairs, and we have at least 30-35 patients doing this treatment every day. There are total 36 treatments that are required. And if you're asking me how often you have to do this, majority of my patients, they do it one time and then they respond to the treatment or they are in remission. There's a difference between response and remission. Response is defined as reducing their PHQ-9 score to at least half. For example, if somebody had a PHQ-9 score of 28, we will define a response as their score of 14 or less. So at least 50% reduction in their PHQ-9 score. So the other beautiful thing about TMS is that it doesn't have the side effect that you see with antidepressants or that you see with electroconvulsive therapy. For example, ECT can cause memory loss. TMS doesn't cause that. It's a very safe treatment. At the most, you will complain of the headache or the discomfort that you feel with the tapping on your head, just like an MRI machine. So that is the most that you hear about it. It's not indicated for people who have a metal plate in their skull or people who have a history of seizures. They have to get a clearance from their neurologist, but they can still do it. There are many different reasons for seizures, so it depends on what caused the seizure. Because this is a treatment which stimulates your brain, so hyperstimulation of the brain can lead to a seizure. So it's not indicated for people who have a history of seizures. So please go ahead, ask me any questions.
Well, thank you so much, Dr. Ali, because one of the things is that one of the questions that I had gotten asked or to ask you was, are you sure you don't see temporary lift or mood that does not last after the treatment period?
So we use Neurostar TMS, and Neurostar is known for collecting the data. So we, just like you have been doing, we are recording your PHQ-9 scale from the day one till the end of your treatment, and then we see how long you stay in remission or how much you have responded. Most of our patients, they do respond, and the response is sustainable, okay? But very few patients are there when they have a new stressor in their life. For example, I had a lot of patients who were in remission, and boom, COVID-19 happened. And a lot of these patients, they came back and they did the second round of treatment and they were in remission. Okay? Your remission rates usually go up with second or third round of treatment. So I have patients who have done second or third round of treatment, but most of my patients, if you ask me majority, they only did one round of TMS.
Okay. And when interfering with the brain, is there a potential cause of cumulative neural damage?
Not at all. This is a treatment that has been studied over years, and that's why we don't just do the same treatment for everyone. Everybody is different. So when you come in, we do the brain mapping. So based on the shape and size of your head, the measurements are different, okay? So on day one, what we do is we position our patients and we move this probe forward and backwards like this one. This is just like an MRI machine. So we move it forward and backwards, medial and lateral, and we see how your brain responds to different stems of magnetic field. Okay? So not every patient is given the treatment at the same dose.
Hi, my name is Ashley. I'm a TMS treater, and this right here is our TMS treatment chair. This is for our transcranial magnetic stimulation. We're going to be delivering some magnetic pulses to the prefrontal cortex in order to treat treatment-resistant depression. So right up top is going to be the coil. This has two sensors here so that we know we're in the exact spot we need to be, and the screen also helps me with keeping connection as well. The chair is nice and comfortable for the patient. Everyone has their own custom settings so that the patient is comfortable and we have them set exactly where they need to be for treatment. So TMS stands for transcranial magnetic stimulation. Basically what that means is we, transcranial, the head, we will be delivering magnetic pulses into that prefrontal cortex. That is your mood center. So that is where we want to treat any sort of treatment-resistant depression. So if medications are not working, therapy's not working, this is a great way to get those magnetic pulses, stimulate that brain, and get things working the way they need to. All right, so here is Tracy getting her treatment for today. That is what the machine sounds like. I'll go ahead and show a little up close. So we have a side head pad and our coil that delivers the magnetic pulses, making sure we're just in the right area. And that little strap you see on her forehead, just make sure she's nice and centered. Right here, we went ahead and blurred out her information, but it shows just what her prescription strength is. And those little dots right there make sure she has full connection for her treatment. The treatment is about 19 minutes long, and you get a total of 3,000 pulses. And that is her treatment. She'll be here for a little bit with me, hanging out, watching whatever she wants to watch, and we can hang out and talk if she wants to as well.